Hi, my name is Joelle and I'm going to be your occupational therapist today. Today we're going to be administering the Time Up and Go test, also known as the TUG test, which is usually administered for older adults, people 60 and older, as a way to examine their functional mobility, their balance, and then if they're at fall risk. So with you being 60, we're going to be performing that test today. This test has excellent inter-rater reliability and it has excellent criterion validity, which really just means that it's accurate and tests exactly what we're trying to test. Is it okay if we perform this test today for you?
Yeah, sure.
Okay, great. So let me explain the test. You're going to be seated here. When I say go, you're going to stand up. I'm going to move this here out of the way. So when I say go, you're going to stand up and walk to where that tape is or that cone. You don't have to go around the cone, but once you get to the tape and both feet have passed it, you're going to turn around and come and sit back down here. I'm going to be timing you. I'm going to start it as soon as I say go and then end the time as soon as you sit back down. Just try and go as quickly but as safely as you can. We're going to do one practice round and then we'll do 2 actual trials and then I'll find the average of those and that will be your score. And then we can find the testing scores and the results for that.
Great.
Sound good? Okay, so this one's just gonna be a practice round. I'm gonna keep time here on my timer. Okay, so let's practice first really quick. Ready, set, go. Great. Okay, so that was our practice round. I'm going to have you do it 2 more times, and this time I'll actually keep the time. Okay, ready, set, go. Great. Okay, we're just going to do it 1 more time. Ready, set, go. Okay, great. So your average time was 8 seconds, which for your age group, normal would be under 10 seconds, with you being 60, so 60 to 69 would be normal for the 10 seconds. If you did have greater than 14 seconds, then we would consider you a high fall risk. But with you being in the normal range, you should be able to move around your home comfortably, you should have adequate balance and functional mobility. You should be able to walk around the community and be about without needing any assistance or assistive devices. If you were a high fall risk, you would not be able to move around without any assistive devices. If you were over 30 seconds in your age range, you would need assistance and assistive devices. And biologically, this could be caused by muscle mass being lower than before due to aging or loss of muscle tone. Psychologically, this could cause embarrassment or frustration due to not having your body move the way you want it to. And then socially, sometimes it can be a little bit embarrassing if you're the first one of your friends to have an assistive device like a cane or a walker, and that can cause less social engagement due to just not wanting to go out and see your friends. So yeah, but since you are in the normal range, you shouldn't have any issues with that. Do you have any questions for me?
Nope.
Okay, thank you for performing this test.
You're welcome.
Now that we've talked about the occupational performance of someone who could score with a high fall risk on the TUG test, let's talk about some evidence-based interventions that can help these individuals. So I found an article called Sensory Challenge Balance Exercises Improve Multisensory Reweighting in Fall-Prone Older Adults. In this study, the participants were 20 older adults ages 70 or older who had a history of falls. And this intervention focused on improving the multisensory reweighting deficits, which has been shown to contribute to falls in older adults. The methods in this study included a quasi-experimental repeated measures design, where they had 8 weeks of a baseline and then went into 8 weeks of an intervention period. And that intervention period included 16 sensory balance exercise sessions that were performed on a computerized balance training equipment. After these weeks, the results showed a significant improvement in multisensory reweighting, balance, and lower extremity strength. As we look back towards the big meaning of this, we really want to look at these older adults gaining that functional mobility and that balance, as we can see that it promotes independent living, social engagement, and increased quality of life. We want to make sure that these older adults do not have fear of falling. They are able to be about in their community and engage socially with their peers. We don't want them to feel embarrassment. We want them to be able to reach their functional mobility and balance to the best of their capabilities. And on the next slide, I have my references. Thank you for listening to my assessment assignment.